Welcome to the PharmaVOICE 100 one-on-one video series with Karen Groen.
Kanchan, congratulations on being named to the 2020 PharmaVOICE 100.
Thank you so much. It's a very exciting time and I'm really happy to be given this award.
Thank you as well for joining us for our celebration marathon.
Yeah, it's really wonderful that you all are doing this for everyone. Thank you for doing it.
It's our pleasure. Kanchan, you have been credited with expanding the scope of Alkermes' medical affairs function. How do you envision the role of medical affairs continuing to evolve?
Medical affairs brings tremendous value to every phase of drug development. We communicate the science and the treatments the company is moving forward with. With our medical credentials, scientific know-how, and credibility among stakeholders, we are the natural owners of scientific information within our company and across the life cycle of our products. An article by McKinsey, A Vision for Medical Affairs in 2025, is one I suggest you all should read. In today's environment, with the current technology, regulatory, and economic trends, we see an even clearer case for medical affairs to be positioned as a strategic leader alongside our research, development, and commercial colleagues. Data mining, data generation, data packaging, and data dissemination are essential components of what we do in medical affairs. Education, dissemination of data through scientific communications, and generation of real-world evidence lay a strong foundation for the value proposition of our products. It is imperative that we in medical affairs generate and communicate the clinical and economic value proposition of all of our products. And how do we do this? First, we need to expand our stakeholders beyond the physicians to entire treatment teams, patient advocacy organizations, payers, policymakers, professional medical societies, caregivers, leading education institutes, and even social media influencers where appropriate. We need to have a robust insights generation process in place, and we need to become listening or sensing organizations. We need to then ensure that all the insights that we generate get integrated into our clinical programs and our strategies. We are also very well positioned to seek the information to generate patient outcomes. We need to be the voice of the patient internally and include clinical endpoints in our trials which are meaningful to patients. We in medical affairs need to develop and establish a trusted and substantive presence in the disease areas we work in and communities we serve by focusing on driving information and patient-centered healthcare.
That's excellent. Tell me how the gap between education and clinical practice can continue to be bridged.
The key is to provide the right education in the right format to those who need it and at the right time. Understanding what the knowledge gaps are with each stakeholder group is the first step before even the education can begin. We need to use robust educational analytics that will provide us with answers or at least give us some hints that the educational programs that we are conducting fulfill those gaps that exist. Including the patient voice in the educational programs is extremely critical. And this is what we hear often from all HCPs. And we need to ensure that the education that we provide has the patient voice in it and serves the needs of the patients as well. The healthcare landscape is constantly changing in today's environment and never as much as it has in the last few months. The medical affairs teams need to continue to adapt to fulfill their purpose to patients and to the clinicians that we serve. And it's also very, very important to think about the digitization of medical affairs. Digital medical affairs was always on the horizon, but now it is accelerated in the current environment. We need to find out what do our stakeholders need. We need to provide them easy access to information on our products, easy access to information on the disease areas that we're working in. We need to provide them easy access to resources, and in the format that is most convenient to them and what they are asking for. Taking these approaches will make us even more effective and efficient and bridge that gap.
Thank you so much for being with us, and congratulations again.
Thank you so much once again.
For more PharmaVoice 100 content, visit www.pharmavoice100.com.